Close to 40 million Americans suffer from sinusitis every single year. So what do you do? Well, if you live here in the RGV, you come and visit Dr. Frank Glatz. If you're one of the millions of sinus sufferers, you're probably all too familiar with facial pressure or pain, a stuffy nose, and perhaps the inability to breathe correctly.
I had a bunch of stopped up passageways, and this was the problem. I never had one side or the other at the same time free. It was only one would work or the other would work.
Bob White was one of those people who says living with sinuses was an annoyance that wouldn't let him sleep and was slowly taking over his life. His friends recommended he visit Dr. Frank Glatz, a board-certified ENT physician who's been working on patients at Valley Ear, Nose, and Throat since 2004.
We pretty much take care of all ear, nose, and throat disorders, but one of the ones in particular that we've been focusing on since a new therapy became available has been balloon sinuplasty. Very effective therapy for people with mild to moderate sinus disease.
Balloon sinuplasty is a minimally invasive procedure that's performed right in his office. So quick and easy, Dr. Glatz says general anesthesia isn't needed for this truly life-changing procedure.
Basically, it just dilates open the sinuses. A lot of people suffer from sort of what I would call just small openings in their sinuses, and when we have these really tiny little openings to the sinuses, if everything's not perfect, they can be a little swollen and closed, and that gives you facial pain, pressure, predisposes to sinus infection, cuts down on the ability to breathe.
And those are just some of the concerns that are felt.
People that don't breathe well at night because of their sinus disease. If you don't breathe well at night, your oxygen level drops. That creates a lot of release of stress chemicals. People don't go through their normal phases of sleep at night, so instead of going into rapid eye movement sleep and the deeper phases of sleep, they would tend to stay in shallower levels of sleep that really is not restorative. Most of those people will tend to be hungry during the day because there's an imbalance of the chemicals.
Balloon sinoplasty's objective is to expand sinus pathways and restore healthy drainage. The entire procedure takes about 15 minutes, and for most patients like Bob, the results are instant.
The ability to be able to breathe was almost immediately.
These patients are among my happiest. That's one of the most exciting things about this procedure. It's not many times in someone's career that a new thing comes out like this that actually really works well. So if patients are happy, I'm happy, I feel good because I'm making people feel better. So it's one of those feel-good procedure for everybody, really.
Even better, there's practically no downtime. Most patients are able to resume normal activities within 24 hours. And if you're still skeptical, here's a pretty remarkable stat.
This is a 98% two-year patency rate. That's a very highly effective procedure.
So if you're wondering if this procedure will benefit you, the doctor says the best candidates will be those who
get more than 4 to 5 sinus infections per year for multiple years in a row, or patients that have failed traditional therapy. So somebody, say, that's undergone, allergy testing, allergy treatment, medications, but they still wake up in the morning and have facial pressure, a lot of mucus production, they're not breathing good at night. Basically, people that have failed traditional medical therapy, a lot of those patients are potentially candidates for balloon sinuplasty.
Such a quick and easy procedure, just look at Bob's results.
Now I can breathe freely, and it's a nice feeling because it feels like you're breathing fresh air every time you take a breath. I don't know how you could get any better. This is about as good as it gets, I'm sure.
So if you're interested in balloon sinuplasty, visit Dr. Glatz Valley-wide or give him a call. You'll be glad you did.